And the interesting thing about that is that when I saw the COVID recovery clinic and they diagnosed me with long COVID, they suspected at the time that I also might have had POTS. But they don't diagnose POTS and they don't know how to treat POTS. So although they were willing to treat the long COVID part of it, it didn't make any sense to me because POTS is so common with long COVID. It didn't make sense to me that they could treat long COVID without treating the things that go along with long COVID. So I walked out of there and thought, okay, I don't really trust this as an umbrella process for me.
Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hello and welcome back to another episode of What Did the Patient Say with our patient interview series. My name is Dr. Matthew Peterson, and today we'll be talking with my patient here, Laura, about her experience going through treatment at CFNC for long COVID. Thanks for joining us today, Laura.
Sure.
Pleasure to have you. So, to start off, could you please share with us some of the symptoms that you initially presented to the clinic with and when all of this started for you?
Oh, the second part of that is a loaded question. So when I first started to see the clinic, my primary complaints, I guess you could say, were fatigue and energy crashes. But I also had a lot of nausea. I had temperature dysregulation, dizziness. I had a lot going on. At that point, I had severe chronic migraines, but they were under control because I had been under the care of a neurologist, a headache specialist for that. But the thing is, I got COVID in late 2021, and it took 2.5 years before I was diagnosed with long COVID because I had sudden severe chronic migraines that were so bad, I was pretty much bedridden. Every time I got up, it would trigger a migraine. Like they were so trigger happy, and I couldn't be on my feet for more than 5 minutes. And it just, we thought the fatigue, my primary care physician and my neurologist thought the fatigue was related to living in a state of migraine 24/7. They were that bad. And fatigue can be a part of severe migraine. So we didn't know until 2.5 years later when we got those resolved, and the energy crashes and the fatigue was getting worse at that point. And then they're like, oh, well, what else should we be looking at?
Yeah, absolutely. And so that was about 2.5 years later. So that would have put us probably into 2023, 2024 timeframe. And that's about the time that you came to us, was around May of 2024. So this whole journey in general for you has been a long one, but we've been a part of it for quite some time at this point as well.
Right.
So thank you for sharing that. You already alluded to some of this a little bit, but I think there are a couple other pieces that are important to note. What type of care did you receive prior to coming to see us?
Well, when I first started having really bad migraines, I started seeing a Reiki specialist. She's kind of like a body works therapist. So she does Reiki, manual lymphatic drainage, and acupressure and Ayurvedic modalities. So I've been seeing her for 4 years at this point. I saw my primary care doctor. I saw a neurologist who specialized in headaches. And then I was eventually referred to a COVID recovery clinic. And the interesting thing about that is that when I saw the COVID recovery clinic and they diagnosed me with long COVID, they suspected at the time that I also might have had POTS. But they don't diagnose POTS and they don't know how to treat POTS. So although they were willing to treat the long COVID part of it, it didn't make any sense to me because POTS is so common with long COVID, it didn't make sense to me that they could treat long COVID without treating the things that go along with long COVID. So I walked out of there and thought, okay, I don't really trust this as an umbrella process for me. And this is going to lead into your next question, which is, how did I find you? I started looking at my health insurance network and which doctors in my network treat POTS, because I didn't know anything about it. I was reading about it online. I had never even heard of it at that point. So I just started digging and doing research, and there were no doctors within my network that I could identify that know how to treat POTS. But your clinic came up and I thought, okay, that's about an hour away. I can do this, because I saw that your clinic also treats migraines and treats long COVID in general. And I thought, okay, this might be the type of clinic that could oversee my care, not to do everything, but to at least understand what condition it is I'm dealing with, because it is very complex, and to help me navigate this maze.
Absolutely. And that's a point that I want to touch on with the long COVID and the dysautonomia link that exists, because I think by now a lot of us are familiar with that, and it's becoming more and more prevalent in the research as well. But we've started kind of colloquially referring to long COVID or COVID-19 with lingering symptoms as almost like an infectious brain injury, because we see so much overlap between people who have had a mild traumatic brain injury or a concussion, or even more significant brain injuries, and the deficits that we see in people with long COVID. It just due to the anatomy of the brain and something like a concussion, a lot of the brainstem structures where our autonomic centers live tend to be more affected than a lot of other areas of the brain. And so due to some of the long-term inflammatory processes that take place in the situation of long COVID, we see disruption of a lot of those same networks, those same areas within the nervous system. And so they can present very similarly, which is why we see so much of that autonomic presentation in a lot of people with long COVID. But yes, complex is a great way to describe our journey together.
Yes, because it turned out that other symptoms started popping up, because, I've had COVID multiple times, so it didn't all happen right away. It's been kind of like I mentioned in the office. I read somewhere that people say it's like whack-a-mole. You hit one thing, you get that under control, and then something else pops up, and then you hit that, you get that under control, and something else pops up. That's been my story.
Absolutely. Whack-a-mole, we'll sometimes say it's like peeling layers of an onion, where, we get one layer peeled, like, okay, the autonomics are looking pretty good now. And then we start to see, oh, but the mitochondrial function is something that is lacking.
No.
Yes, and we'll dive into that a little bit. So as I mentioned, Laura came to us originally in May of 24, correct? I said that right? Yeah,
right.
24, yep. And so we've been seeing her in some capacity since then. So May of this year, right, we're going to be going on 2 years, which is kind of crazy.
I know.
When she first started coming, like she said, she's got a little over an hour drive. And so it's not exactly feasible for somebody who is dealing with autonomic issues and chronic fatigue to come into the office for an hour visit 3 days a week when you have to drive an hour plus both ways. So the way that we structured Laura's care was we had her coming in usually 1, sometimes 2 days a week. But in those days, she was coming in for multiple visits in a day, which we call an intensive day. This really allows to cut down for the driving time, which we also found for Laura could be a trigger for the migraines and some of the energy crashes and things like that. So we wanted to mitigate that as much as possible. In the office, a lot of the things that we did dealt with neuromodulation. So that's going to be electrical stimulation of nerves. That throughout the course of treatment, the location really ranged, whether it was places of the face, tongue, and neck, and stimulating some of those cranial nerves that run directly back into those brainstem areas. We did a lot of stimulation on your feet and legs to try and, one, kind of help to bolster that brain-body connection, but also just help to get those muscles activated and manually pump blood from the legs back up to get oxygenated and recirculated. We did a lot of eye movement type activities, a lot of passive modalities oriented at improving blood flow. So whether it was our Beamer pulse electromagnetic field mat, the red and near infrared light therapy was a big one. And then towards the end, we've also implemented some compression therapy on her legs. And I would say, especially in the initial phases, one of the huge things was the hyperbaric oxygen therapy. And we, especially early on when we first started with Laura and in the long COVID sphere, there still wasn't even a lot of research out on what are truly the modalities, the treatments that have been proven in the literature to be effective. And shortly after she started seeing us, we started seeing some papers come out about hyperbaric therapy being one of the kind of most tried and true at this point. And so we were like, well, check, we're already doing that. So headed in the right direction already. But we went through that initial phase where it was pretty intense, seeing her at least once a week, multiple visits in a day, with HBOT in between those visits. And then we kind of just continued to taper from there to where we are now. A lot has changed throughout that time. Like you said, with whack-a-mole and different things popping up, of course, approaches changed throughout that time frame. But as we really started to see a lot of the neurological aspects stabilize, but we still had this baseline, we'll say kind of decreased capacity is probably the best way to put it, with the fatigue and just your ability to do the things that you needed to do. That's where we really started diving a lot deeper into the mitochondrial aspect.
Well, I also started having a lot of cognitive dysfunction, which was mimicking the patterns of the physical dysfunction. And that's when we thought, oh, maybe there's something else going on here.
Yes, exactly. It kind of opened up the cover to that rabbit hole. And so over especially the last, few months at least, we've really shifted our focus. We're still doing the neuro rehab and all of those things, but shifted the focus also to what can we do to maximize mitochondrial function, and looking at from both supplement and lifestyle standpoint, going down the ACE2 enzyme rabbit hole, which more and more research now is coming out about the role of not only the ACE2 enzyme in tissue protection when it comes to some of the damaging effects of COVID, but also the ACE2 receptor playing a big role as almost like a portal of entry into the cell for COVID. And so also doing a lot of things to support that as well. So it really has been a pretty all-encompassing package that Laura has gotten both from a neuro rehab and a metabolic support standpoint. You have anything to add to that?
No.
Okay.
No.
Then my next question for you, Laura, is in your own words, what would you say your experience as a patient at CFNC has been like overall?
Oh, it's been fabulous. Absolutely wonderful. The staff is really friendly. The care is extremely thorough. I would say my favorite part is that Dr. Peterson is very, very open to reading all of the research papers that I bring to him and say, hey, what about this? Hey, what about this? And just being open to trying different things, because this is so new. You know, research is evolving. The research is being done, but I don't think a lot of practitioners are up on what research has been done because there are no clinical guidelines at this point. So just the fact that you were willing to read what I had found, because I don't expect you to research everything that's out there for every patient that you have, but for patients to be their own advocate and to kind of go down those rabbit holes at least a little bit to say, hey, you know, like in my case, the mitochondrial dysfunction, I had seen articles and found research that was pointing that this was a thing with long COVID. And I thought, can we look at this? And not only were you open to looking at it, but you were open to, when I found protocols that other doctors were using with their long COVID patients successfully, can we incorporate some of this into my treatment plan? And we've kind of massaged that a little bit and figured out what works, what doesn't work, and we're learning so much through the process. So just being open to an exploratory process, I think, has really helped me.
Well, and I can say that while it has helped you, it has also just helped me become a better doctor. I always tell patients, like, we don't know everything. We're human at the end of the day. And so, yeah, if you have something, bring it to me because I want to learn more. And I will say, Laura has given me more homework than any other patient that I've had, but clearly it's been worth it.
But it's because it's been so complex too. And, I didn't know what was going on half the time. So thank you.
Thank you. Compared to when you first came to see us, how would you say that you're feeling today?
I don't even remember what level I was at when I first came to see you because I've been up and down so much. And I want to tell other people part of that has been my fault because I'm very ambitious and I do international research conference planning, which is very ambitious. So I've been throughout this illness, flying to Hong Kong, doing a conference in New York, doing a conference in California. I set myself back by at least 6 months by putting myself into a 6-month crash on the back end of this last conference that I did. So, just, I guess, learn your limits. I'm not very good. Pacing has been my downfall because I'm not very good at staying within my energy envelope. So how am I feeling now? Wherever I was, I would say my mental energy is at 90% at this point. And there were times when my brain energy was crashing to where I had no executive function. So there were times, I was at 20%, but I'm at 90% now. Physical energy, I would say 80% at this point, which is huge for me. Because Absolutely. I know at my worst, I was like 2 or 5%. There were times not only could I not get out of bed, I couldn't even change positions. I couldn't lift my head. It was really, really, really bad. So I'm thrilled.
As am I. A quote that made me very happy. Actually, Laura was in the office earlier today. She had a couple of appointments today, and one of the things that she said to me was, "I feel like a real person again." And
I do. I feel human.
Yes, a real human
again.
Yes.
I feel human again.
And that, I mean, that's what we're going for, right? Making life feel like life again. So it's just been really cool to be a part of that. It's been really cool to see you come as far as you have.
Thank you.
Okay. Well, Laura, you kind of touched on it a little bit too, but if you had one piece of advice to give to somebody who was experiencing what you're experiencing or who was thinking about coming to CFNC and see what they have to offer, what would that advice be?
Oh, just be your own advocate, which I did say earlier. And also, make sure that I don't know if there's one doctor who can cover it all when it comes to long COVID, but make sure that the person that you choose, and hopefully it's someone at CFNC, is the one overseeing your care because they get the brain. And this is all functional brain issues. In everything that I've researched, everything that I've read, that's what it comes down to. Everything that I've experienced with brain signal misfires and cognitive dysfunction and just real dysfunction, as soon as your team works on my brain, things improve. Imagine that. So yeah.
Awesome. Well, thank you so much for joining us today, Laura. For everybody listening, if you have any questions, please feel free to leave a comment or reach out to us. Also, please visit our website at carolinafnc.com for additional information on our treatment programs and how you can get scheduled. Awesome. Laura, thank you again so much. Always a pleasure. And I will see you next week.